Okay, so what we're going to do is we're going to work our way through the whole digestive tract, kind of like we did with respiratory, and we're just going to cover each of the different parts of the GI tract and each of the different organs as we go. So just like with food and water, how we start in the oral cavity, we're going to start our discussion in the oral cavity. So the oral cavity, remember, is just the mouth. Sometimes it's called the buccal cavity. What does buccal mean? Cheek. Right? Buccal refers to the cheek. So the buccal cavity is the cavity within the cheeks or between the cheeks. And we've got a few different things that happen in the mouth or in the oral cavity. One is the sensory analysis of food before we swallow it. So we have receptors present that tell us about the taste of the food, that tell us about the temperature of the food, that tell us about the texture of the food. And this is pleasant sometimes, right? We probably wouldn't eat as much if the food didn't taste good, right? If it were gross and it were a chore to eat, we wouldn't have the same drive to get those nutrients in us. So it is an evolutionary benefit that food actually tastes good to us. But this is also very protective. Again, before refrigerators, before we have our like processing methods that we have now and storing methods for food, it's very likely that you're going to take a bite of something and it's going to be rotten, and you need to know. So if you take a bite of it and it's disgusting, you can spit it out. That's a lot better than swallowing it and eating something that's rotten and toxic and then getting sick later. So tasting your food and temperature as well, right? It's important to know that it's really hot before you start to burn your throat. That sensory analysis in the mouth is important. This is why babies have more sensitive taste buds. Babies' taste buds are very, very sensitive because their systems are more sensitive. So anything that's very like alcohol or anything that's really strong tasting should offend the infant's taste buds more so than it would an adult because their system's likely to not be able to handle it. In the mouth, we also chew, right? We already talked about mastication, which is chewing. And this is the mechanical processing or the actual physical mechanical breakdown of our food. Again, we tear it, we mush it, we kind of squish it, rip it apart into smaller pieces. This makes it easier to swallow. And then what else does this physical processing help speed up? Chemical processing. Why? What does it increase? The surface area. Good. Lubrication is important in the oral cavity. We release a lot of saliva into our mouth, and even just thinking about eating, right, or smelling good food will start the saliva secretions. And that saliva is really important. One, because it does lubricate the food. Lubricating it helps to break it down physically, right? It dissolves, and then it also makes it easier to swallow. Also, that fluid or saliva is important because it does have some enzymes present that start the digestion of some of our foods. Okay, so we'll see this in a second, but the saliva has enzymes that break down carbohydrates, and then there's an enzyme that can start to break down lipids. It typically doesn't work until we get in the stomach, though. All right, so the tongue is obviously an important organ inside the oral cavity. The tongue's important for speech. We talked about the larynx or voice box, right? What's that sound production that occurs at the larynx called? Somebody's whispered it, I think. Phonation. So we just produce raw sound at the larynx, that's phonation. We utilize the mouth, the lips, and mainly the tongue to take that raw noise and convert it into speech, right? And what do we call that? Articulation. Good. Or enunciation, but articulation is the way that we utilize our mouth to convert that raw sound into speech. Obviously highly important for humans. The tongue is also important for manipulating the food, right? Pushing it around your mouth, getting it ready to swallow. It's actually really important for pushing it back into the throat so that the throat muscles can take over. Try swallowing without using your tongue. It's really hard. Your tongue is really important for that. And then we talked about this already, but the sensory analysis of our food. Texture, temperature, taste is gustation. Okay, so the taste is gustation. We utilize gustatory receptors. Receptors that tell us about whether it's umami or bitter or sour or sweet are gustatory receptors. So in the oral cavity, we said that we have 3 pairs of salivary glands. The names of the glands themselves should be familiar to you guys from lab, right? What's the gland called that's up here? Parotid gland. Underneath the tongue, you have the, and then underneath the mandible? Good. So we've got 6 salivary glands that produce saliva. And each pair of glands is very distinct and different. Cellularly, their makeup, you can see that they're different microscopically, but also the saliva that they make is different, and it's drastically different volumes of saliva as well. Here you see those. Again, it should be pretty familiar to you, but the parotid, right, really superficial by the ear, again, where the joint of the jaw is. Sublingual, meaning underneath the tongue, and then submandibular, again, sits underneath the mandible. That's where most of your saliva is going to come from. Notice they each have ducts associated with them. Okay, so all of these little like white tubes that you see are showing you ducts, and then you can see where they actually empty in the oral cavity or in the mouth. So again, you make a ton of saliva, much more than you would think. I mean, 1.5 liters is a lot. To think of the fact that you got 1.5 liters of spit every day in your mouth, like that is a lot of saliva every day. That's a lot of fluid. Again, most of these come from the most of this comes from the submandibular glands. I won't ask you volumes or anything now. And when we look at the saliva, it's mostly water. Okay, again, you will have liter upon liter upon liter of water put into your GI tract every day. Water is highly important for digestion. Less than 1% of it is solutes. So when we look at these solutes, we've got some electrolytes, right? Some ions, some salts, some buffers. Buffers are important because they're important to prevent cavities. But there is a bacteria called Streptococcus mutans. Lives in the mouth, and it feeds off of sugars, right? So the doctor's like, don't eat too much sugar, you're gonna get cavities. That's very true. This is why sugars lead to cavities. Streptococcus mutans takes sugars and it metabolizes, converts or metabolizes sugars into acids. Acids eat away the enamel. Remember, the enamel is that strong protective coating on your teeth. So a lot of people have Streptococcus mutans living in their mouth. It's colonized a very large percentage of individuals. So then if you eat sugars without brushing your teeth and flushing and getting rid of them, they just sit there and Streptococcus mutans feeds. And the bacteria is super, super happy. And it starts metabolizing those sugars and just making lots and lots and lots of acids. And then the acids just sit there around that area and literally wear away at your enamel or eat away, digest, dissolve that enamel. And that's where cavities come in. So the buffers are really important to try and deal with the acid, right? We don't want a super acidic environment in our mouth because it does eat away at the enamel. So saliva is actually very helpful, and the more kind of watery your mouth is, the better, because you're constantly secreting buffers to help neutralize that acid. Mucins, we'll talk about in a second, but they're glycoproteins that are important for lubrication. Antibodies help to prevent bacterial growth, so you don't have too much bacterial growth occurring in the mouth, try and prevent infection. And then we have some enzymes present. We'll talk about these on the next slide, but we have enzymes to help us digest sugars, which will actually start digesting pretty well in the mouth, and then lipids. And again, we'll talk about how the enzyme for lipids normally does not work into the stomach. It's a lot of talk about spit. Goodness. How long did you go on about this? Slide saliva is really important though. Like if you have patients who have dry mouth or a lot of medications, like pain medications, a lot of antidepressants, psychotics will cause really bad dry mouth. And it is detrimental for patients. It is really difficult for patients. Saliva is actually important. So functions of saliva. One is that it helps to flush the mouth, right? That's a lot of fluid that's constantly flushing out the mouth. And anytime there's a flushing action, you're helping to prevent bacterial buildup. Right? We talk about urine flushes out the urinary tract. When feces comes through, it helps to wash out the GI tract. Saliva flushes out the mouth. We also have IgA and lysozyme in order to kind of kill those bacteria that we see in the mouth, but really the flushing action is just extremely important on its own. Again, it helps to moisten and kind of lubricate the mouth. That's important for the epithelium, right? This epithelium is not keratinized. It is a non-keratinized epithelium, so it needs to be moist in order to function. And that's important for when we try and swallow food. Again, imagine swallowing a piece of bread or a chip with no moisture at all. It's going to simply just scratch all the way down your throat. So that lubrication is important for swallowing. Saliva also helps to, so when it gets wet or when it moistens your food, makes your food wet, your food gets mushy, right, and starts to break apart. And that liberates a lot of taste chemicals for us. If the taste chemicals are stuck in the center of that food, you're not actually going to taste them. It's only upon chewing them and breaking apart that food and having that food kind of dissolve in your saliva that you're able to actually stimulate your taste buds. We mentioned that saliva also has two enzymes present in it. And this is kind of what I want to focus on right now. So it's got an enzyme present in it that breaks down carbohydrates, and then it's got an enzyme that can start breaking down lipids. So we'll start with salivary amylase. Salivary tells us it's coming in the saliva. And what did we say amylase is? Breaks down sugars, right? So in the saliva, there's an enzyme that breaks down sugars or carbohydrates. So salivary amylase begins the digestion of carbohydrates in the mouth. Remember that really large carbohydrates are called what? Polysaccharides. Right? Huge, like glycogen, starch, really, really big sugars that have tons and tons of sugar molecules linked together are polysaccharides. It takes multiple steps to break them down. First, we'll break that huge molecule down into little like disaccharides that have 2 sugars, right? Or we could do trisaccharides that have 3 sugars. So that's what we do in the mouth. We take this huge molecule and we start to break chemical bonds so that instead of a giant polysaccharide, now we've got some disaccharides and some trisaccharides. We'll break them down further as we go down into the intestines, but we start that breakdown in the mouth. Salivary amylase does not work in the stomach. The enzyme only works in the mouth. Once it gets to an acidic pH, it's deactivated and it stops working. So once we get to the stomach, we're not breaking down sugars anymore. That actual breakdown of sugars that you're going to have with your salivary amylase is only for that short period of time that it's in contact with the saliva. Lingual lipase is different. So lingual, because it's coming from the sublingual gland. Lipase, what do you think lipase breaks down? Lipids. So lingual lipase is in the saliva, and it starts breaking down lipids. Lingual lipase does not always work in the oral cavity though. Sometimes lingual lipase won't start working until we get down into the stomach. Sorry, I keep like, your stomach is not right here. I keep tapping right here. This is like uterus. I'm not sure. The stomach is up here. Starts breaking down lipids, but it needs an acidic environment to do that. So lingual lipase typically works between a pH of like 3 and 6, which remember 7 is neutral. So that's an acidic pH. We hope that our mouth is not an acidic pH. Sometimes the mouth will be around 6, but lingual lipase is not necessarily working in the mouth. However, once it gets down to the stomach, it does work. And we'll see that the stomach, we've got a lot of hydrochloric acid, which is like pH of like 1. So it's a really, really acidic pH, but all of the food and water and everything that's there buffers that. So if this lingual lipase is working at a pH of 3 to 6, it's likely working in the stomach for quite some time. Okay. So we do digest some lipids in the stomach, but the enzyme actually comes from the saliva. into the pharynx. What's the pharynx? The throat. The pharynx is part of the digestive system, and then we also looked at it because remember it's part of the respiratory system as well. Right? So we see that air is also going to be passing down through the pharynx as it goes towards the larynx and respiratory tract. And then food and water are going to pass through the pharynx as they go down to the esophagus. Remember that the pharynx has 3 parts. What's the first part? Nasopharynx. Food and water should not be going in there. Okay, the nasopharynx is just for air. Food and water should not be going up into the nasopharynx. From the mouth, you go directly back into the oropharynx. So that's where the path for food and water should go. It should go directly from the mouth into the oropharynx. Then what's after the oropharynx? The laryngopharynx. And then that brings us down into the esophagus. The pharynx is highly muscular. It's like a kind of funnel-shaped passageway that's made up of numerous different muscles. There's lots of what we call constrictors around it, but there's a lot of different muscles involved in the throat and in the pharynx. One reason is because the pharynx, it does its own kind of pushing down of the bolus of food. So once you push that bolus of food back into the pharynx, the muscles of the pharynx take over to keep that bolus of food going down and push it down into the esophagus. Remember, these muscles are also really important to help make sure that food and water do not go into the respiratory tract. Okay, so remember, what did we say happens when we swallow food and water? What happens to the larynx? It goes up, right? Your larynx or your voice box gets pushed up when you swallow. And that's all because of the muscles that are in the pharynx or throat. So as those muscles are pushing back the bolus of food, they're also raising up the larynx. And remember, that pushes the epiglottis on top of the glottis, right? It pushes that lid on so that the food and water that you're swallowing are not going to go back down to the respiratory tract. Now, we also said that the food and water should not be going up either, right? It should go back into the oropharynx and then down. So when we swallow, the muscles also elevate the soft palate so that the food, and kind of constrict the muscles back there so that the food and water aren't going up into the nasal cavity either. Just like if you've ever had fluid in your mouth and then you hang upside down without swallowing, it can go up into your nose. But if you actually swallow, you should close off your nasal cavity, even if you are in an inverted position. So when we look at the pharynx or the throat, the very bottom of it should remain constricted. And I'm going to give you kind of a caveat here. This is what your current textbook says. Your current textbook says that at the bottom of the pharynx, there's constrictors or little muscles that stay constricted. And when you swallow a bolus of food, it gets pushed through and then they constrict again. So it says that the very bottom of the pharynx is always constricted. Why do you think that would be? What do you not want to go down the digestive tract? Air, right? Remember, air is going to take the path of least resistance. So if my digestive tract, if my throat and esophagus and everything were just open, when I breathe in, the air would go down there too. And I don't want a bunch of bubbles going down into my stomach. That hurt. That's not good. So we have a sphincter present that stays constricted so that when we breathe in, the digestive tract is closed. So the air just goes forward into the larynx instead. Now, your current textbook says that this is at the bottom of the pharynx, that the bottom of the throat stays constricted, and that we call this the upper esophageal sphincter. And remember, the lower esophageal sphincter is at the top of the stomach. A lot of textbooks will say that this is like the top 3 centimeters or so of the esophagus. Okay, so the upper esophageal sphincter could be part of the esophagus, or it could be at the bottom of the throat. But either way, the point here is that there's constricted muscle that prevents air from going down into the esophagus. Here again, we've got the pharynx, the nasopharynx, the oropharynx behind the oral cavity, and then the laryngopharynx behind the larynx. Again, when you swallow, remember this is your soft palate over here, and then we've got a bunch of muscles over here. When you swallow, this should close off so that the food and water don't go up into your nasal cavity. The food should go back into your oral pharynx and then down the laryngopharynx. Here you can see all of the constrictors that are present. Again, it's highly muscular. And those muscles, again, are important for pushing the bolus of food down. You can see how they're so closely associated with the actual larynx. Right, this is the front of the larynx, so that this can get pushed up when we swallow. And then I wonder if, no, we can't see it. But then again, this area, like right around here, will also remain constricted, so that when air comes in, it doesn't go down this pathway, right? Then the air just goes down the open larynx and into the respiratory tract. All right, so after the pharynx or throat, we get to the esophagus.